Okay, part 2 of Nursing 435, week 3. Developmental task, parental attachment and bonding. Attachment is the process by which a parent comes to know and love and accept a child, and vice versa. The child knows and loves and accepts the parent. Bonding in the first few minutes after birth, when the mother, father, and newborn have close contact, is optimal for the child's later development. However, bonding is a process that can happen even with adoptive parents, and doesn't necessarily have to happen in the first few minutes. It's developed and maintained by proximity and interaction with the infant. So that's a key factor. So even if it's an adoption, the parents can still bond with this close proximity and interaction with the baby over time. Positive feedback between parents and infants through social, verbal, and nonverbal responses facilitates the bonding process. Parent-infant contact is a process that occurs over time, as I mentioned. Early contact, like skin-to-skin bonding, is good. Extended contact over time is what's required to establish firm bonding. Communication between parent and infant occurs through things like touch, eye contact, voice, and actually odor. Newborns can actually identify who their parents are just by smells or their primary caregivers. Becoming a father, that's a whole process for the dad, and there are definitely some issues for him to come to terms with. Remember, he's not the one that carried the baby, so this is his first attachment time. The adolescent mother presents another problem, a concern. Because she is an adolescent and has developmental needs of her own, egocentricity and concrete thinking often interfere with her ability to parent effectively. She's in the period of time where it's all about me, and how dare this baby come in and disrupt my life. Mortality rates are much higher among adolescent mothers than in older mothers. The transition to parenthood can be difficult because they have their own developmental needs, and they are more prone to postpartum blues. So just keep an eye out for those adolescent moms. Parenting, fostering bonding in women of varying culture and ethnic groups. Remember that nurses need to become knowledgeable about childbearing beliefs and practices in diverse cultures and ethnic groups. Incorrect judgments can be made about parent-infant bonding if nurses do not practice culturally sensitive care. So if you have someone from a culture that which you're not familiar, please ask or look it up, and don't make assumptions about the lack of bonding just because they're from another culture. Perhaps that's not in their culture to bond in the first 24 or first week even. Maternal postpartum adjustment. There are 3 phases. The first one is dependent. She's dependent, taking in phase. For the first 24 hours up to 2 days, the focus is on themselves and meeting their own physiological needs. They rely on others to meet their comfort needs, rest, closeness, nourishment. They're excited and talkative, and they will talk about the birth experience over and over and over again. It's kind of like they're saying, "Wow, what just happened?" And they're trying to come to terms with this whole process. The second phase is the taking hold phase. Mom's still dependent. It happens, it starts usually the 2nd to 3rd day and lasts about 10 days. This is where the focus becomes the care of the baby and competent mothering. She wants to take charge. She still has a need for nurturing and acceptance by others, but she's eager to learn and practice, and it's an optimal period for teaching by nurses. So right before mom goes home, remember 2 to 3 days postpartum is when they go home. Handling of physical discomfort and emotional changes can be discussed, and mom will probably be open to those kinds of discussions. The third phase is the independent or letting go phase. The focus is forward movement of the family as a unit with interacting members. She has a reassertion of her relationship with her partner. The relationship will change now. It's no longer a couple, it's now a family. Resumption of sexual intimacy occurs, and resolution of individual roles. In addition, self-care, patient and family teaching, self-care of the breast, nutrition, perineum, intercourse, and contraception are critically important in the postpartum teaching, and we'll get into some of that. Infant care, bathing, feeding, how to take a temperature, and infant safety, things like car seats, are really important things to discuss at this point. And that's the end of part 2.